Partner Jimson, we are live.
Thank you. Well, good evening, everybody, and welcome to, this is a committee meeting, standing committee meeting of council for April 4th, 2022. You have before you a copy of tonight's agenda. I'm looking for a motion to adopt as presented. Okay. Councillor Chambers, Councillor Dufert, any questions to the motion? All in favor? Thank you. Motion carries. Item number 3 is any declarations of interest. None being noted. We'll move on to item number 4, announcements, awards, ceremonies. Anything from council? Anything from administration?
Thanks, Your Worship. I actually do have one announcement today. I thought worth recognizing our own Stacey Barnes, who qualified this weekend at the NWT Dart Championships to go on to the Nationals. So congratulations to her. And I think she's off to Toronto, hopefully this summer. Congratulations,
Stacey. How exciting. I did want to shout out as well to a couple of long-term residents. Mr. Gary Carter had a birthday last week, and Rosa Luda turned 94 as well. So I wanted to wish them both very happy birthdays and hope they have another amazing trip around the sun this time around. So with that, we'll move on to item number 5. We have the Hay River Health and Social Services CEO with us tonight, Erin Griffiths. Welcome, Erin. And with that, I'm going to pass it over to you.
Great. Thank you, Mayor Jameson. Thank you for taking the time and having me present tonight to Mayor and Council. I do have a couple of updates about the business of the HRHSSA regarding focusing mainly on the COVID update and the changes around COVID over the last over the last few days since April 1st. So as you all know, the public health emergency did end on Friday of last week, which means there's quite a few changes to how we go about our business and how, for the health authority specifically, how we continue to conduct our business to not only keep our staff and our inpatients and our residents safe, but the community members as well. So some of the changes that we are working on, and we are working with our territorial partners and the CPHO as isolation. As you know, isolation is no longer required as of Friday of last week. Highly recommended if you are COVID positive that you do isolate within your home. But as you know, if you are tested COVID positive, there's no reporting requirement anymore and no requirement for isolation. It's just highly recommended by the CPHO and obviously supported by the health authority as well. And along with that line as well, vaccinations and proof of vaccinations, that is no longer required either. But businesses and companies can choose if they still want to ask for proof of vaccination, they certainly can do that. But it is no longer a requirement. It's just highly recommended that people get 3 doses. They get their booster dose as well, and their booster shot as well, to help protect themselves and also obviously the community as well. Because we have to be very mindful that even though the restrictions have been lifted, we still have COVID in our community. COVID still exists. And we do have a number of residents in our community that do not or will not, which is by personal choice of their own, receive the vaccine. And some people are immunocompromised. They're unable to get the vaccine due to health condition. So we just have to be really incredibly mindful of those folks in our community that still live with us, obviously, and still work with us as well and go to school with our kids as well. As testing as well, along the same lines, obviously testing is ramping down as well. The focus of testing is moving towards rapid antigen tests, which is the RAT test, which is the home test, which you can pick up from North Martintown for free as well. They're distributing those. And so we will continue to have testing at the health center, but we are actually pulling back on the availability of that testing center, basically based on demand. We're going to review our testing center needs over the next couple of weeks, but also recognizing we have spring break coming up and we have a lot of people traveling. We'll do another review of our testing center at the end of June. If numbers continue to decline or stabilize, then we'll look at either closing the testing center at the health center and just go for home and just support the home testing model. Or we'll continue to test here at the health center based on numbers, and we'll review that again after the summer, knowing that there's quite a few people that will be traveling in the summer as well. So testing, we're highly recommending people to do the home testing, because also with our testing clinic, just like our territorial partners, we're redeploying staff within in order to manage that testing center, which is a real challenge. It's a real stress on obviously other areas. We've been doing this for 2 years now. And it's really putting a lot of pressure on our staff and our team to continue doing their home job and their position where they're supposed to be and they were hired into, in addition to supporting a testing clinic and a testing center here at the health center. So just be mindful of the fact that we are moving towards rapid antigen testing. Now, of course, there'll still be medically recommended testing from a physician or our public health unit. So we're looking at options after June or even after September, what that might look like and where that might be offered out of. For example, we may close the testing center, but testing may be available through a referral or through our lab service, through our public health service. We'll look at the demand at the end of June and what that might look like for us to change that model a bit as well. Travel, as you all seen, the border is wide open again, as exciting as that is. And obviously, self-isolation plans are no longer required either, recognizing that the COVID Secretariat has wound down. And so we do not obviously need to file the SIPs anymore for travel as well. Gatherings, obviously the restrictions for gatherings have been completely lifted as well, both for indoor gatherings and outdoor gatherings. Again, though, highly recommended that if people are going to gatherings, that masking continue and social distancing continue. I know it's been tough. I know we've had a lot of gatherings over the last 4 to 6 weeks in town, and it's challenging because we do want to return to that normal, that new normal. But again, like I say, whenever I talk about this, I want to be mindful that we still have folks in our community that are still at risk. And part of that gathering restriction as well, it includes our cafeteria. We've had a lot of questions from public and general public to see if they can come in and eat in our cafeteria, which they did before COVID. But we continue to have our cafeteria at the health center closed, just like we have for the last 18 to 24 months. And the reason for that is we don't want the large gatherings, knowing we have vulnerable and people at risk with their health always in our facility. We always will, looking for lab service, looking for DI service, even inpatients. So we will continue to keep our cafeteria closed to the general public. And again, that's something else we will reassess at the end of June to see if we can reopen that to the public, but right now it will stay closed. And one of the other, obviously, one of the restrictions that have been lifted is masking as well. Again, businesses can choose if they still want to continue requesting for masks or not, both by the public and by their staff. It's totally up to their decision. Again, obviously, we're highly recommending that. For the health authority itself, all of our staff will continue medical masking at least again till the end of June, till we get through spring break and the school year. We'll reassess over the summer months for that. But we're also asking all visitors, clients, patients, and residents to wear medical masks when coming to all of our facilities. And the reason for this, again, is the same. And we have vulnerable people within our facility, and we want to keep them as safe as we can and minimize the risk to those who are already not feeling well or sick in our inpatient unit, to dialysis unit as such. So when our residents come to any of our facilities in the community, they will be asked to wear a medical mask, and we will provide those masks for anyone who does not have they don't have their own medical masks. So cloth masks, unfortunately, we'll just ask them to remove those, throw them in their pockets, and we will provide them with a medical mask. So those are some of the updates regarding how this is going to work for us moving forward. 811, that phone number is still continuing. It's still being manned, but just on reduced hours. Before it was 7 days a week, it was 12-hour days. Now 811 is available Monday through Friday from 8 to 5:30 as well. We're going to continue that through the Department of Health. And again, we're going to review that on an ongoing basis, looking at the number of the data, how many people are calling, what they're calling for, and quite possibly expand the role of that number to possibly flu clinic in the fall or general health questions. But for now, it's focused only on COVID. Businesses, and again, they have the choice which restrictions, if they'd like to keep any or all of them in place. Again, it's going to be their own personal choice. And if we find ourselves in an outbreak, we do have supports from our territorial partners, and they have supports from us that a team will come down and support us if we have an outbreak, a significant outbreak within the community. But as all of you have seen and have experienced, some of you experienced as well, and our community members have experienced, that this COVID strain right now is a lot like a cold or a flu. So a lot of people are staying home, not feeling well, but they're able to manage it within their home and within themselves. So that's been more positive, if we can find a positive in this at all. And so that's been really important as well. So other than that, that's really my update regarding COVID. Mayor Jameson, would you like me to open it up for questions now or after my full update?
Maybe questions now. I just flew out. I was quite surprised at the airport. I was asked for proof of vaccination and we're required to wear a mask. So and when I arrived in Yellowknife, I did not see anyone without a mask on. So it's interesting. They must have a lot of cases because everybody is wearing a mask. I was quite surprised. Any questions from council? Councilor Boucher, go ahead.
Yeah, thanks, Aaron. Just a question on, you mentioned outbreaks and stuff like that, and obviously GNWT is not updating the amount of cases in the community anymore, from what I know. And or will there be announcements if we get to a certain level of cases? You know, like last time I think I read we had 45, and I'm not sure where we stand today, but you know, especially over this little, I want to say, like you said, till June, this buffer period of a couple months, will there be posts or information from public health that we urge people to be very diligent right now because we have a large cases, or are we just going to go for no information like that?
Yeah, no, absolutely. Thank you for the question. So our public health team is working closely with the CPHO. Obviously, the dashboard is changing from the CPHO, and it's going to be more like a red light, green light, yellow light status. We're not involved with complete case numbers, obviously, because people are not required to report. And so we will not have a solid number. Public health will have an idea, but not a solid number. But the reason we're going to the green light, red light, and yellow light is the fact that we're still measuring wastewater. And if our wastewater spikes or our wastewater gets high, that's when we can actually go from the green to the yellow to the red. And then that's when we'll work with our public health unit, and we will put out public advisories that way. We unfortunately won't be able to give you a case number because we won't know the case number, but we will know that our wastewater is at a certain percent. And based on the CPHO epidemiologists, they can tell us a possible range of cases we may have in the community at that time.
Perfect. Any further questions? You're getting off easy tonight, Aaron.
I am. That's awesome.
Yeah, so continue. Back
okay, perfect. All right, thank you. One last thing I did want to mention with COVID, and some of you may know this already, we do have a number of COVID cases within both our supported living services facility and our Woodland Manor facility right now at this point in time. And so it's between staff and residents. So you'll notice that our visitation has been stopped for both facilities starting last week, actually last Thursday, and that will continue until those cases have subsided. So, and we increased testing for all staff and all residents who are still continue to be negative as well. So we're keeping a close eye on that situation. My other update, as you've noticed, is regarding staffing and recruitment. So you've noticed over the last couple of weeks that I've put out a couple of community communication notices, just so people are aware of some of our pressures, not just right now, but pressures we're going to be facing over the next probably 6 months to 8 months. And some of those pressures are basically in those same areas we've had for a while, but we are experiencing the great resignation throughout healthcare, not just in the North or Canada, it's a global resignation. So the pressures are finally caught up to Hay River and Hay River Health, and we're starting to feel that in certain areas. So I want to make sure, be completely transparent with the community so they know where our staffing pressures are. And if we have to do any reductions in service, they're not surprised. They're well aware of what we're doing and what we have to offer. So some of those areas that we continue to be pressured in, as you know, is physician recruitment. We do have a substantial, well, actually we have a full complement of physicians for the month of April and well into May. We continue to recruit, obviously, all the time, well into the spring and summer months. And we're working with our territorial partners on recruitment of physicians. And as part of our recruitment, not just for physicians, but for all of our positions, we're increasing our online presence. And also our presence at universities and colleges, and going directly to the student body in order to start looking at possible recruitment. In addition, for physicians, with physicians, we're also continuing to look for occupational therapists, physiotherapists, diagnostic imaging, which is our laboratory technicians, and also our x-ray techs as well. We have pressures already, as many people know, in our rehabilitation department. We've been posting for a couple of years now for both OT and PT, but we anticipate some resignations, some retirements. Some people are going back to school in some of our diagnostic imaging areas as well. So we're expecting some pressures over the summer in those areas as well. And just for example, we've anticipated upcoming retirements for the last couple of years. So we started advertising for certain positions 18 months ago, and we still have not had any interest in our posting. And if we have, unfortunately, they don't qualify for the position through the screening process. So it's a really tough time to recruit, especially during pandemic and post-pandemic. I do want to let the community and yourselves know as well that we do have some nursing resignations coming up as well. And so we have some pressures in our nursing area, especially on our front line. And again, when our employees do leave, when they retire, when we receive resignations, we do offer exit interviews. So we have an idea of what is happening within the facility, why people are leaving. And so we can actually look at and get the feedback from these folks to see what we can do in order to improve recruitment and retention. And a lot of the themes of some of our younger folks that are leaving and moving on, it's family, their families down south. They only came for a couple of years, their family's still down south. Spouses are down south with children. They didn't join them in Hay River, so they're heading out. We've got some folks that are going back to school in the fall as well. And the retirements, some of our retirees have been here for a really long time, so it's just their time to retire. Housing is a huge issue for our staff. We have a lot of staff that are sharing accommodation at this point in time. So housing for rental, not so much purchasing, but a lot of our folks, our young folks that are coming up, they're looking for rentals. That's been tough. And cost of living. As we all know, the cost of living continues to increase, and that's been a bit of a challenge for our staff as well. So we have some themes, some really common themes, and a few things we can address and we can work on. But I also think working with the community to assist us with recruitment and retention of our professionals, I think, is a really good next step as well. And so that's my update. We will continue to be totally transparent with our staffing challenges, so no one is caught off guard or surprised if we need to reduce services at any given time over the next probably 6 to 8 months. And thank you. So that's my update for today. I'd like to open it up to any questions.
Thanks. Any questions from council? Go ahead, Councillor Dufert.
Thank you, Worship. Not a question. I just want to express thanks to Aaron and the rest of the team. The end of the 2-year period has come. We didn't think we'd get through it, but we did. And you guys did a wonderful job and we appreciate it. Thank you.
Thank you so much.
Any other questions, comments? Go ahead, Councillor Bouchard.
Yeah, kudos again to the team, that's for sure.
Yeah.
Been a long couple of years there. I think we've talked about it before, Aaron, just that recruitment side, is there much, just question to you, is there much that we can do from a town's perspective? I know I volunteered the mayor the other day to do a tour with some mining companies, but is there something that you can see from our side from perspective of recruiting? And while I'm talking recruiting, I'll ask you, do we continue to use GNWT in their recruiting resources as well?
Yeah, thank you, Robert. So yeah, we do actually. We partner with the GNWT. They're very generous for us to kind of piggyback onto their platforms and their recruitment platforms, their advertising platforms. So we have a number, and also with the Northwest Territories Health and Social Services as well, we work closely with them as well. And Practice NWT is also a GNWT platform that we utilize as well. So no, we are recruiting in conjunction with our territorial partners, which has been a real bonus for us as well. But like I said, there's a lot of things that that we're competing with, not in the north, but also in the south. And so we want to be that one employer that does stand out. And like I said, we want to increase our presence on social media and getting into the schools and universities. As for assistance right now, Robert, I think a lot of it is housing. Like housing is a big issue for a lot of our staff. And I think another big issue, not just during COVID getting burnt out, but a lot of working with our vulnerable population was a big task over the last couple of years. And I know working with Mayor Jameson, we've come up with a working group to assist with that. And I know working with both shelters has been a huge bonus for us as well. But if there's anything, I'll definitely reach out. But right now we're hearing, I think as a community issue, is housing and the rental market lack thereof for some of our new staff and our new young staff.
Perfect. Anything further from council?
There's one more.
Yep, go ahead, Councillor Boucher.
I mean, I think for a while ago, we were talking about the GNWT incorporating, I know Haver's outside of the GNWT realm. Is there still that discussion going on at the territorial level? Do you know, have you heard of any of that discussion going on lately? Maybe it's a Brian issue, but I'm not sure.
So I can start, Robert. That's not a problem. I know it is one of the longer, the current Legislative Assembly has it as a priority on their priority list of priorities, not the top 10 that they've got, but I know I've seen it in a document with a number of lengthy priorities, but I don't believe it's at the front of the discussion at this point in time, but I will hand it over to Brian for further comment as our public administrator.
Thank you, Aaron, and thanks, Robert. Yeah, just as Aaron has mentioned, those discussions are not at the forefront of the burner, as you may well know. I was watching the budget go through. It's certainly not part of the mandate at this point in time. There are significant costs involved, and we all know that the government is facing challenges on many fronts when it comes to resources. So I would suggest that that is accurate. It is not in the top 10 for sure, but the conversations do continue to go on. So thank you.
Thank you. Any further questions? None being noted. Aaron, please pass along our thanks to your staff and yourself for all you do. It can't be easy having a shortage in the middle of a COVID, and we know there's a few cases in Hay River right now. So yeah, thanks for all you do. And it's been a long 2 years. Hopefully that we're on the downhill slide. And again, please pass on our thanks from council and myself.
I will do. I certainly will. And thank you for your time tonight. I appreciate that.
Thanks for coming out.
Thank you.
Perfect. Okay, moving on to item number 6, administrative inquiries, and I'll pass it over to SAO Smith.
Thank you, Worship. I just wanted to start with a couple of things related to the public health order lifting as of April 1st. CEO from Hay River Health and Social Services just ran through some of the details there. So I just wanted to make note, though, that they did issue several recommendations, and specifically around isolation scenarios. So we went forward with lifting the town's face mask policy for staff and facility users in consideration of our continued alignment really with the Chief Public Health Officer and public health over the course of the pandemic. We did issue staff to our communication to our staff that is in alignment with those, and gave instructions on if they had symptoms, have COVID, or if a household member has COVID. But I do think that, despite these lifting of the health orders, and we have introduced sort of our workplace accommodations under those scenarios of COVID symptoms, et cetera. I do anticipate, I think we all are probably anticipating that we're going to have maybe more significant COVID impact in the coming days and weeks and months, maybe. And that's going to put certainly some more pressure on our business continuity for staffing. I think we might even get to a point where, it's, I guess, plausible at least that we will see some of our essential services having to work with COVID. just to keep those critical services running. We were trying to take measures to not do so, and obviously we'd be putting in controls that would help mitigate those risks. It is allowed, but it is not recommended by public health, recommendations from public health certainly towards how we are managing our staff. Outside of that, we'll just go do a roundtable and then I'll get back to my own update. But we'll start first with the Director of Finance, please.
Thank you, Worship. Start with a reminder to businesses operating within municipal boundaries that the deadline for paying business licenses was last Thursday. So we'll be sending out some reminder notices, and again, just a reminder to review the fee schedule as our fees have changed from previous years. Happy to announce that our new accounts payable clerk will be starting here on April 11th. And so that'll bring our finance administration team back up to being fully staffed. We posted the 2021 tax arrears listing on March 31st. So this is in compliance with our legislation, PATA. So a reminder to all taxpayers who are in arrears that beyond the 1.8% monthly interest charge, which accrues on outstanding balances, there's also penalties associated with any legal letters and ultimately with the tax action or the tax auction, which can be charged on overdue accounts. That concludes my updates. Thank you.
Any questions from council for our Director of Finance? Nothing noted. Back to SAO Smith. Thank you, Director.
Thank you, Worship. We'll go next to the Protective Services Director, please.
Good evening, Your Worship. Tonight, I don't have too much to update on outside of what's in my report. I will speak to updates on breakup when we do talk about the community emergency plan later. But for right now, the only thing I would add is that with the changing situation with COVID here, I know we've definitely felt an impact on the emergency services side and also an impact to our members, myself included, just not feeling well today. So we'll be, I'm discussing with the officers right now about what our measures will look like for response and what sort of protocols we'll have in place to be consistent with the health center and stuff. And if in doubt, when we are in a situation where we can't manufacture a response with all healthy people, what our protocol would look like. So we're in the process of working that out tonight, actually. So after this, I'll continue to work on that and update you guys once it is completed. Thank you.
Thank you, Director. Any questions for our Director of Protective Services? You will have an opportunity later as well. So moving on back to SAO Smith.
Thanks, Your Worship. The Protective Services, other departments are certainly seeing the effects of COVID right now for us. So it's still, like I mentioned, it remains right at the top of our business continuity planning to try to keep things moving forward effectively, especially now as we start moving into our own busy season of breakup and pending emergencies that could arise through it. We'll go next to the Acting Director of Public Works and Services, please.
Thank you, Your Worship. Aside from what's in my monthly report, there only got a couple other items that we're working on currently. We're currently working on to put the as and when tenders out, contracts out for fuel, equipment rental, dust control, and aggregate. Hoping to have that out by mid-April. The current contract ends April 30th. Another item is the tree falling for Fraser Place is completed. That was done today. I believe they hauled 18 or 19 loads out. So we still got a little bit of brushing and grubbing there to do before we shut that down till excavation starts. So we'll be removing all the signs and everything, pretty much making everything wide open to the public once everything's cleared out and there's no safety concerns. And that's pretty much all I've got right now.
Thank you, Director. Any questions from council? Councilor Willows, go ahead.
Thank you, Madam Mayor. Is it our intention to continue with the water surveillance for COVID for the foreseeable future? I know there's been some conversations going on the last month or two, so just wondering what's happening in that, especially in light of the presentation from the CEO at HRHSSA. Thank you.
Thank you. I'm going to pass that back to SAO Smith.
Yeah, thanks, Your Worship. I'm not aware of any specific conversations. I know there has been some questions. Unless the acting director of Public Works is aware, we have been continuing to support, perhaps beyond our original agreement with MACA on the equipment that is installed at lift station lift station 1, which gets about maybe 50% of our community coverage on the piped sewer system. So I haven't had more conversation, haven't entered into any agreements there. Would suggest that once our lift station 4 is in operation, if there is an agreement that can be reached, that would be perhaps a better lift station for us to look at this summer. Anything, Director of Public Works, that you've heard?
No, I have not, but what I could do is check tomorrow and get back to you, Glenn, with some type of answer on that there going forward.
Thank you. Councillor Boucher, go ahead.
Yeah, I too was interested in that. Obviously, I think that's a good indicator for us, and just for this buffer of the next 3 or 4 months at least, we kind of have an indicator of what kind of, I think there's still lots of nervous people out there about how much COVID we have in the community, so it'd be nice to know that. But I have another specific question if nobody has any question on that one.
Go ahead, further. Go ahead.
Yeah, just obviously today was a beautiful day, melting and stuff like that, and just wondering, I know we have that Riverview Drive, Beaver Crescent, even I think Caribou's done, but just snow removal in that area, I'm concerned with that area being very, very rough with a bunch of melting snow and stuff like that. Have we had discussions about removing snow so that's dries up a little quicker?
Director of Public Works.
Thank you, Your Worship. Yes, tomorrow I'll be meeting with our engineering firm going over the contract from last year. I've only been here for a couple of months, so I haven't gone through the entire Riverview Beaver contract on how the contractor is supposed to respond, but I will have something on that tomorrow as well.
Thank you. Any further questions from council? Nothing noted. Back to SAO Smith.
Thanks, Your Worship. I do have several things to run through. First, I just wanted to start with and maybe congratulate and thank council, our senior management, and our unionized supervisors that gave up a good portion of their weekend over March 25th and 26th to participate in our corporate strategic planning workshop. Obviously, a very important strategic document for us that guides this council through the next several years and beyond that as well. It was very condensed and maybe a little rushed through the weekend, but I feel the input and direction that was provided does a good job in supplementing what we identified in our 2019-23 plan. So thanks for that. And there is still a fair amount of work that's needed from me and our consultant to kind of draft up the findings that came out of the weekend and tie up some of the loose ends, and then bring that forward as a draft to probably the Committee of Council to validate that, and then to council for approval. Several kind of electrical power services items going on that's been on my plate as of late. One, we did submit our comments to the regulator on NTPC's major project application for their Tallston generation system upgrades. So these are very significant upgrades. I think estimated at about $60 million. We did review it thoroughly, had our legal and regulatory bodies look through it. No real significant challenges, and their project elements appeared justified. So there will be an opportunity at another point in time when they do bring forward that project as through a rate application, and we could choose to intervene in the process at that time. With respect to rates, though, NTPC did submit an interim and a general rate application to the PUB last week. It's for the entire territory, and there was inflationary type rates that I would equate to inflation, at least throughout the Northwest Territories, but also a rate recovery adjustment for the Tallston zone, which we are sort of part of. We obviously get power from the NUL, or sorry, from Power Corporation and the Tallston hydro system, but as we know, NUL distributes the power in Hay River. So the indication of the revenue increases from NTPC for their wholesale rate was 10% increase this year in 2021, and another 10% increase in 2022. So that rate applies to NUL for sale of power to the town of Hay River, but we haven't received notice yet from NUL of a rate application for the distribution here. We will want to determine if it is worth the cost of intervening. Actually, I believe some of those costs are picked up through that process from NTPC. So we'll have to just determine if we want to intervene and provide any challenges to what's been submitted. And then also on the electrical franchise agreement. So the town has submitted information to MACA just last week. And that's with respect to the town's interest in finalizing a franchise agreement with NTPC. So I expect to bring forward a recommendation to council this month to advance that agreement process. Also, I should mention too, we are dealing with Northland Utilities on a couple, one tendered project, another on, two tendered projects, but one of them hasn't been awarded yet with respect to the services that they will be providing, electrical utility services for those projects. So we are working through them on a couple of issues there. We did submit recently 2 full funding applications to CanNor. A lot of work went into those applications, and we are hopeful and optimistic, I guess, that we will get approval on them to be determined probably through the summer. But one of them was to support, again, the downtown streetscape beautification project, and the other was for the Sundog Business Park design. Myself and the Director of Finance are meeting with Lands and the Hay River Agricultural Society tomorrow, and that's to discuss land tenure options to support some of the agricultural development interests that we're hearing within the community, and as per usual, a struggle to access land. A draft Hay River Housing Needs Assessment has been submitted to the Hay River Housing Plan Advisory Committee for feedback, and there is a committee meeting this Wednesday to discuss that. I will be acting in the communication role for this year's spring breakup. The Director of Protective Services is going to speak later on to one of the agenda items around our emergency plan. But that activity will keep me quite busy as work through the communication plan this week and developing materials. We're going to be using several distribution channels again. That'll include our emergency services email subscription system, our town website, Facebook, our door-to-door information packages, the local EMO council. We do have it in our plans to have a public meeting with Vail Island and other more likely impacted residents. Work with the media, and do plan to try to introduce some messaging coming through an FM radio station that covers the town. I met last week with the NWT Film Commission, whose primary reason for traveling into town was to tour the Cold Road film production set. But on our agenda was a discussion of the community support for film production, some of the economic development opportunities that might exist, a run through of the film tax incentive programs that the GNWT offers, and a permitting process which communities that host films on a more regular basis would put in place. So I think while the market demand is fairly limited in the Northwest Territories, the economic spin-offs are quite strong. We're aware of some of the spend targets associated with Mr. Redvers and the Cold Road set, or Cold Road production. but we're in a pretty decent position here in Hay River to support film crews and film productions. And one of the benefits presented to me was around any films that are in Hay River could qualify for up to a 40% tax credit incentive through that NWT Film Commission, opposed to, say, Yellowknife, which I believe it's at 25%. So thinking through our tourism coordinator position, and perhaps in partnership, we haven't reached out to them with the Hay River Film Society. We might look at a permitting process, get a little material on our website for marketing, and put a role in the tourism coordinator for film liaison in case there is interest. And just meeting with the NWT Film Commission last week, literally a day or two afterwards, I said, I'm sure our council is open to the supporting that and the economic spin-offs that could come for the community. There's other parties that are interested. I did get a call the next day from a production company that is running a prominent series on the History Channel, and they are interested in coming to our area this spring to do some scouting. So, a nice little economic development opportunity that's spurring out of the support that council provided for the ongoing production that's in town right now. I've also been working on the terms of reference for what I'm suggesting could be called the Social Issues Special Committee of Council. This is the interagency discussions and direction that's come through council recently. So I've drafted those terms of reference, and the direction is to be brought to the town's policy and bylaw committee for review. We're hoping to meet on April the 19th, and then we would bring that forward to council approval on probably the subsequent meeting, April 25th. Administration is planning to meet this week to review our final draft of the new zoning bylaw. We're very, very close to wrapping that up from the administrative perspective. And then it will be presented to the Policy and Bylaw Committee as well at that April 19th meeting, and then onwards from there. Recruitment activities continue for the Director of Public Works, our ASAO position. We have a heavy equipment operator that's vacant, lifeguards, and a lot of summer student positions are now being advertised on our tourism coordinator. Although we do expect an announcement on that one as early as this week. And just encourage council and the public to spread the word, especially on our summer student positions that we're recruiting for. And I think that concludes my update. Any questions, Mayor Jameson?
Thank you. Questions from council. I saw Councillor Bouchard. Go ahead.
Yeah, Your Worship, just the first item there, that power franchise. I know a while ago, I think we received kind of an update on timeline wise. Do we have an update? We were told, I think, summertime, but summer or late fall type thing. So are we still on track for that type of a transition period?
I'm going to pass that back to SAO Smith, but I do believe we are.
Thank you, Worship. Yeah, we continue to meet regularly, and there hasn't been a change to that. End of summer, early fall is when we would hope to. It is dependent on different parties, of course, and some indication that NUL will be needs to go through a rate application process as well. So some of that could come up as additional time, but at this point, we've got a process that we need to work through on our franchise agreement itself. That might take a couple months, but that's all part of the schedule, and interim rate applications, and NTPC is preparing for that, as well as other ancillary type agreements. So best indication at this point is still that end of summer, fall for the majority of this.
Thank you. Councillor Willows?
Thank you. I've got a comment and a question. First of all, the comment, I think Councillor Bouchard was asked the question with regard to HRHSSA and any discussions about going forward to becoming part of the public service. And I would just direct council to there is a list priorities of the 19th Legislative Assembly. There's 21 points there that are priorities for anyone that wants to know what the priorities are going forward. The second thing is we have a number of balls in the air as it relates to the electrical franchise with NTPC. So, and I don't know the answer to this question. Has the town of Hay River ever applied for intervenor status in the past as it relates to rate increases? And what would be the determinants of whether we would or would not apply for that status?
SAO Smith.
Thank you, Worship. I don't know the complete history, but I have seen through review of some of our invoicing tied to our ongoing franchise agreement, there has been, it appears to be some intervention that occurred maybe during the last major rate application, or so I believe so. I was kind of backtracking a little bit during my update because the determination for me is if it's worth the cost of the legal fees and regulatory consultation that is occurring. And there is some difficulties in challenging work that is from a subject matter expert. But I think, and I just want to clarify it, but I do feel now that there is cost coverage through the rate application. Obviously, those costs get passed back into rate somehow, but I believe the town might not incur at least the full cost of those interventions. So in that situation, it's more consumption of time, but we do use third-party expertise usually for that type of work, or would.
Thank you. Any further questions for our SAO? None being noted. Thank you, SAO Smith. We'll move on to item 7A, new business. So A is Public Works Monthly Report for March 2022. Looking for a motion. Go ahead, Councillor Dufert.
Thank you, Your Worship. I move that the Council of the Town of Hay River accept the report. Oh, I forget what it was for. I don't have it up on my screen. Public Works for March 2022.
Perfect. Thank you. Seconded by Councillor Wall. Hang on 1 second. I gotta get so I can see you guys. Okay, agreed to take forward. Thank you. So 7B, I'm trying to work from my phone and my computer. So 7B is oh, Councillor Willow seconded that. Sorry, thank you. Keep me on my toes.
Also, I was just also waving my hand. Can we get the report expanded? I can't read it.
Yeah, you make it bigger. Okay, so we're moving on to item B, which is the Recreation Monthly Report for March 2022. Looking for a motion. Councillor or Deputy Mayor, go ahead.
Thank you, Worship. I'll move the recommendation that the Council of the Town of Hay River accepts the report entitled Recreation and Community Services Monthly Report for March 2022 as presented.
Thank you. Seconded by Councillor Chambers. Any questions to the motion? None noted. Agreed to take forward. Perfect. Thank you. So item 7C is a 2022-23 O&M contribution agreement. Looking for a motion from council. Councillor Willows, go ahead.
Thank you, Madam Mayor. I move the Council of the Town of Hay River approves the operations and maintenance contribution agreement for 22-23 in the amount of $2,265,000.
Thank you. Seconded by Councillor Dufert. Agreed to take forward.
I have a question.
Oh, sorry. Questions? You can tell it's been a long day. I apologize. Councillor Bouchard, go ahead.
Just a question on the amounts. I guess these amounts are the amounts that we're getting from the GNWT. Are they the amounts we estimated when we did our budgeting? Are they higher, lower? Any indication there? Thank you.
SAO Smith.
Thanks, Your Worship. I'll probably just direct it to the Director of Finance if you can speak probably to all three or two or three.
Yeah, thank you, Your Worship. The $50,000 change wasn't budgeted to the O&M funding agreement. The water and sewer agreement didn't change, and the CPI agreement didn't change. The only item of note from the CPI change is last year we did receive a CPI top up of 299,000, which wasn't included this year, but it was that was a one-time only type top up. So that's yeah, those are the changes. Thank you.
Thank you. Any further questions from council? Agreed to take forward? Thank you. Motion carries. So item 7D is a 2022-2023 water and sewer contribution agreement. Looking for a motion. Councillor Willows, go ahead.
Thank you, Madam Mayor. I move the council of the town of Hay River approves the water and sewer funding contribution agreement for 22-23 in the amount of $1,089,000.
Thank you. Seconded by Councillor Dufert. Any questions to the motion? All in favor? Or agreed to take forward? Holy man, this is gonna, I'm only halfway through. Thank you, guys. So item 7E is the Hearst Services Report. Looking for a motion? Councillor Bouchard.
Thank you, Worship. I move the council of town of Hay River approve the recommendation to cease providing Hearst services.
Seconded by Councillor Wall. Is your hand up? Okay. Any questions to the motion? Councillor Dufert, go ahead.
Oh, thank you, Worship. I was wondering if I could ask to have the motion tabled for a week or two, as I've had just in the last couple of days some concerns from residents, and I've indicated that they should send those in email so that we can have a look at them. And thank you.
We are in committee, so this isn't approval of this decision. It will come forward at a regular meeting. I'm
Okay.
thinking our next regular meeting. So yeah, there is time absolutely to hear from the community.
Thank you, Worship.
Okay, and Councillor Bouchard, you had your hand up?
Yeah, I think I'm along the same lines as Councillor Dufert. Just, what does it entail when we cease this type thing? I know some people in the community use that, and I know we're talking about going to a private sector providing that service. I'm not sure if, I don't know where that lands and stuff. I'm concerned how it will work in the future. I know we discussed it at one of the committee meetings, I think one of our budget committee meetings or something like that. And it's just, when I read it the other day, I was like, well, I wonder how that's going to affect and who that's going to affect. I know the usage has probably gone down a bit. Most people are going through information and stuff, but over the next couple of weeks, maybe we'll hear how it kind of response we get from the public. We provide service. I know there's concerns of volunteers to drive it and stuff like that. So, is it something the town should do? Private sector's out there now. There is somebody in the community that wants to provide that service, but and then to sell the Hearst. I think we bought it's been expensive to buy Hearst. I think this last one we bought was used and stuff, so it's very expensive to replace them. So, I'm looking forward to hopefully get a little bit of press on it and we get some people talking about it, and just concerned about what that impacts are further down.
Was there a specific question there?
No, it's an area of concern for me. I'm just making a statement in the fact that, I don't know what kind of details we can get more. Like I know what we've got for costs, and I know the capital costs are there, but it's just a matter of concern, and we'll see what kind of public feedback we get. Thank you.
Yeah, fair enough. It doesn't need to come forward at the next meeting. It can come forward at the following. If that is council wish, I have no problem with that at all. So with that, I've got a mover and a seconder. Any further questions, comments? Councillor Willows, go ahead.
Yeah, thank you, Madam Mayor. I guess the only thing I don't have any real questions or concerns, but in terms of communication, maybe we should be looking at some way to communicate what this is all about to the community, because I agree, I guess, with the other two that have spoke. When you just look at that and the motion as it is presented, it does seem a little cold. But I'm also cognizant of the fact that we are constantly talking about, the town interfering with private enterprise. So I think we just need to maybe communicate a little bit better before this comes to the next regular meeting for a decision. Thank you.
Absolutely. Fair enough. Any further comments or concerns, questions? None being noted. So agreed to take forward at the first meeting in May. First regular meeting in May. How's that? Okay, thank you. So moving on to item 7F, which is CPI funding contribution agreement. Looking for a motion. Councillor Chambers, go ahead.
Thank you, Your Worship. I'll move the recommendation that the Council of the Town of Hay River approves the Community Public Infrastructure CPI agreement for 2022-2023 in the amount of $1,833,000.
Thank you. Seconded by Councillor Dufert. Any questions? Deputy Mayor, go ahead.
Thank you, Worship. Not really a question, more of a statement, comment on all of these contribution agreements. Like we've just heard that there was only one of them that actually increased, and it was increased by $50,000 on over $2.5 million agreement. It's nice to hear all the time that priority is closing our funding gap and all the rest of this. But if we're getting funding agreements that aren't even keeping up with inflation, we're actually going backwards. So there is as much as you hear about that being a priority and all the verbiage that goes on with that, we're still going backwards, and the funding gap is not closing.
Thank you. Could not have said it better myself.
Great point, you.
Yeah, great point. Any further questions or comments? None being noted, agree to take forward. Thank you. Item 7G, which is emergency plan update. Looking for a motion. Councillor Dufert, go ahead. Go ahead.
Thank you, Your Worship. I'll move the recommendation that the Council of the Town of Hay River accepts the Town of Hay River emergency plan as presented.
Thank you. Seconded by Councillor Bouchard. Any questions? Comments? Councillor Bouchard, go ahead.
Yeah, maybe just a comment. Obviously, our EMO group has been starting to have meetings here weekly to start making some plans. I know the SAO and director have been meeting with some of our government agents that we work with on a regular basis, and I think they may have some following information, but I was at a meeting this morning just kind of discussing about taking ice readings and snow readings and stuff like that so we can be prepared for this. Yeah, I guess we're not in COVID anymore, but there is always that concern, and we're back to a normal type of process. But I want to say some stuff is going to continue. We have RV parking that we did during COVID, and I think we're going to continue because there's been a few residents that like that and have that option for evacuation process. So again, a lot of work that gets done a month before the evacuation or potential evacuation and the breakup happens. There's lots of crews and volunteers that have helped through the whole process, and it starts, and it takes a lot of time up from our fire chief as well as our SAO during this whole month. So kudos to them doing the work and being prepared. And this document is one of those things we, as a community, in one way, it benefits us to have an annual breakup where we have to start thinking about all the emergency services that we need to do or we might potentially have to do. So we kind of get a little bit of training that way. So when we've had, when we've had a dump fire or we've had a high-rise fire, some other emergencies, we have groups of people that we know that we call on and we speak on a regular basis annually. Like some communities don't have an emergency and they don't have that planning, but in a theory, we have that annually where we have to start considering that on an early process. So, thank you.
Yes, absolutely. Plan for the worst and hope for the best. SAO Smith.
Yeah, thanks, Your Worship. Administration was open to add a bit of comments here, maybe just to supplement
Yep.
Councilor
absolutely.
Bouchard's, if that's all
Go
right.
ahead. Yeah,
And
go ahead.
I'll pass that on to the Protective Services Director.
Yeah, thank you, Your Worship. Just to add on to that, sorry, there's a call going on right now. There is minor changes to the plan this year. The changes really include dates and updated contacts for position changes that happened. The authority remains the same because we have the same counselors identified, so that didn't end up changing. And just a quick overview for those that haven't seen the emergency plan before. In the plan, it identifies the authority and the process for activation of the plan. It outlines mitigation and operations in the plan, specifically in the hazard-specific plans identified that speak to the different community risks like flooding and forest fires. So typically we have our monitoring and our communications arms up and running, but not the full emergency committee running prior to our evacuation. Once we decide that, that's when it really kicks into gear and our plan guides us. So, our local capacity, basically, once our local capacity is exceeded, then we can call on the government to assist us with whatever needs or resources that we need. But typically, in our history, we've had the capacity to handle short-term evacuations where we haven't had to rely heavily on the government for support. There's a few departments that are directly involved that we engage with, but for the most part, our community is able to handle the capacity. But in the event of a bad enough flood, then we would definitely need to rely on the support of the government for sure. So that's just a quick overview of the plan, and I can give a couple of updates to our current breakup planning. Our planning committee meetings are being held once a week in preparation of breakup. The planning committee is made up of Glenn. He's in charge of communications. Stefan is in charge of the reception center. Earl is in charge of flood mitigation efforts this year and operational support. Councilor Bouchard also sits on it for council awareness. And myself, I am in charge of monitoring and operations that occur with the breakup. So like Councilor Bouchard and the SAO alluded to, the SAO and I met with MACA to discuss this year's breakup and inquire about also other communities' evacuations plans now that COVID restrictions do not apply. It doesn't appear that we are identified as a host community for these communities because we have our own breakup and our own potential evacuees to look after. So we shouldn't expect an impact from that. We've also received our flood brochures from MACA, and we'll be looking to put together evacuee messaging from the town and also packages. We're targeting next week to get those out. We're looking to have ice measurements completed by the end of this week or early next week, and probably it'll take about a week to put that report together. And we did receive our snow survey info from ENR today, but we still have to review it before we put an opinion and report together on it. We're also looking to put together the Community Emergency Response Committee for a briefing and a meeting on this year, and we're looking at hopefully some time next week to do that with all of the departments that may be involved if an event is bad enough. And that's all I have to update on, but I'll keep the council up to date as we move closer to breakup. Thank you.
Thank you. Any questions for our Director of Protective Services? None being noted. Thank you. So agreed to take forward. Thank you. Moving on to item 7H, which is an excused absence. Looking for a motion. Counselor Wall? Yeah.
I move the recommendation that the council of the town of Hay River excuses Councillor McGill from the Standing Committee of Council Monday, April 4th, 2022.
Thank you. Seconded by Councillor Chambers. Do I see your hand up? Perfect. Agreed to take forward. Thank you. Moving on to item 7I, which is the Emergency Services Monthly Report for March 2022. Looking for a motion? Councillor Dufert, go ahead.
Thank you, Your Worship. I'll move the recommendation that the Council of the Town of Hay River approves the Emergency Services Activity Report for March 2022 as presented.
Thank you. Seconded by Councillor Bouchard. Agreed to take forward. Thank you. Motion carries. And we are moving on to item 7J, Municipal Enforcement Monthly Report for March 2022. Looking for a motion? Councillor Chambers, go ahead.
Thank you, Your Worship. I'll move the recommendation that the council of the town of Hay River accepts the municipal enforcement report for March 2022 as presented.
Thank you. Seconded by Councillor Dufert. Any questions to the motion? Agreed to take forward? Thank you. So moving on to item number 8, no notices of motion, and I have nothing for in camera tonight. SAO Smith, do you have anything?
No, Your Worship, nothing identified here.
So I'm going to move on to item number 10, Councillor Willows.
Thank you, Madam Mayor. I move that we adjourn.
Thanks, everyone. Hope you have a great week, and hope everyone's feeling better. That's not feeling so good. We had to go to Zoom again because we were down too many men. So I thank those that did come tonight. And I know, especially when you're not feeling good, it can be a process. So thanks again, and we'll see you next week.